Live.
Hi friends.
Live session again.
Hi friends.
రావాలి కదా ఇక్కడ ప్రైవేట్లో ఉందా?
Hi friends. I'm the
Yeah.
know what it feels like. You've been studying hard in med school, but it's your classmate who keeps getting high score.
Good afternoon to everyone and welcome to today's session. Can you please punch whether the voice is loud and clear? Everybody online? Dr. Balakrishna, Roshan Yadav and many more. Good. We had been discussing ECG, the rate, the rhythm and SVT versus VT, the broad complex tachycardias. Till there we have discussed till now. Today we shall review axis. What are the causes of left axis and right axis deviation? Importance of the Q wave. These are going to be the topics of interest today. I know that there is the most interesting World Cup match where India is rocking, right? So Till entering the classroom, I was following through. Very interesting. High chances that we are going to win over South Africa, right? So, in spite of that, we have 32 online students. Thanks for coming to the class. Now, what is Axis? Our physics teacher has taught a very simple concept to us doctors. Most of the biology, physics and organic chemistry, inorganic chemistry that we study for getting into medical school is utter useless. We don't use it at all in medical school. But physics, if at all we use a bit in ECG. So if you have a negative electrode, a positive electrode, and you are having the charge, when the charge is traveling towards the positive electrode, if you connect it to a voltmeter, in the voltmeter, it typically shows a positive deflection. This is what, can you give me a little voice? This is what our physics teacher has taught us. So if you know that whenever the electric charge is traveling towards a positive electrode, it leads to positive deflection, upward deflection. Whenever the electric charge is leaving the positive electrode, it leads to development of negative deflection. This is what you need to remember. Entire ECG is all about positive and negative deflections depending on whether the charge is traveling towards or is it traveling away from the positive electrode is what you need to basically remember. So now I will tell you one story. Once upon a time, if you do MBBS, somebody used to give a girl, you used to get married, open a small clinic, people used to sit in the OPD, they used to pay 10 rupees and you used to check their BP, sugar and manage a general practice. Modern time, after doing MBBS, people ask you to do MD. After doing MD, they want you to do DM. And after doing DM, you need to become a successful consultant. Then only somebody is ready to give you a girl. So once upon a time, there lived a scientist called Einthoven. Einthoven is in love with... Einthoven is an Italian guy. He is in love with some... Antonino Tito, right? So he want, after finishing MBBS, to get married to this Antonino Tito. Tito's daddy is a very tough guy. He told Einthoven that if you want to marry my daughter Antonino, prove that I have a heart. Your future mother-in-law keep on blaming me that I'm a heartless guy. So Einthoven was thinking, how can I prove that my father-in-law has a heart? So his friend is this Volta guy. Volta said, oh, it's very easy, man, to marry that beauty girl called Antonino Tito. You need not worry. You can easily prove that your father-in-law is having the heart. How can you prove? Very simple. If you look at the heart, the pacemaker is in the SA node. Here the electrical activity is starting. It is reaching the AV node and from AV node it is passing into left ventricle and right ventricle through the bundle of His. Ultimately, how is the depolarization is passing? It is passing from above to below and from right towards left. From the right towards left. So This is called above to below, right towards left is called as the axis of the heart. So how will you be able to realize whether this electrical depolarization is passing above to below from the right towards left? Very simple. Put a positive electrode on the left side, keep a negative electrode on the right side and connect it to a voltmeter. If it shows a positive deflection, that means the electricity is passing towards the left, above from below. Simple. So Volta told Intaven, देखो भाई Intaven, don't worry, connect electrodes to your father-in-law on the with the positive electrode on the left hand, negative electrode on the right hand, but connect his right leg, let it be earthed. Otherwise your father-in-law will become electrocuted. So the right leg is useless for ECG. It is only for earthing. What are the three limbs which are important for the ECG doc? Right arm, left leg. Only these three things are important for the ECG is what you need to remember. So, Intaven went to his father-in-law. He said, "Oh my darling father-in-law, show me your right hand." So, can you give me the slide? So, show me your left arm, show me your right arm, show me your left leg. Very good. So, he put the right leg earthed. He made earthing to the right leg. So, this right arm and left arm are there, no doctor? What he did, he made a positive electrode connected to the left arm and a negative electrode to the right arm and connected it to a voltmeter, and it has shown a positive deflection. And it has shown a positive deflection. So this is called lead 1. How do you get lead 1? Typically, once more I am repeating for you, right arm, left arm. So negative electrode here, positive electrode to the left arm, connected to the voltmeter. Since the electrical activity is passing from the right towards left, you get a positive deflection in the lead 1. So about whose axis are we talking here? We are talking about the Qrs axis. Forget about P wave. P wave axis is not that important. Qrs axis. Qrs axis, electrical axis of, because of the depolarization of the ventricles, which ventricle is thicker? Left ventricle is thicker than right ventricle. So, entire electrical activity is passing towards the left side after originating from the right atrium and passing towards the left side. And since the axis of this normal electrical activity of the heart is above to below, from the right towards left, a electrode connecting the right arm with negative, left arm with positive, which is called the lead 1. The electrical activity is passing towards the left side. So that is the reason the lead 1 will show a positive QRS. Once more, no confusion. What is this positive QRS, negative QRS? Very simple. Any positive wave is R wave. Iske samne, before that, whatever the negative wave you get is called Q wave. This is R wave. Any negative wave that follows the R wave is called S wave. You may not always have a S wave and Q wave, but a positive R wave, anything before that, a negative wave is called, the one which is preceding it is called Q wave, and a negative wave following the R wave is called S wave, is what you have to Emphatically remember, doctor. Now, lead 1 story you know very well. Now, the next story is, how do you get lead 2? By now you got the full idea, probably what I am going to write. So, this is the interven's father-in-law. He has 2 legs. So, right leg is earthed. So, right leg is useless. So, he has the left leg. So, you connected negative lead to the right arm, and the left leg you connected positive lead. You connected these two, and how is the electrical activity passing for this? This is called lead 2. Lead 2. How is it passing? Above to below, from the right towards the left. So that is the reason even lead 2 also is passing above to below, right to left, just like our heart. Right to left, above to below. That is the reason this lead 2 is called the rhythm lead, because it is this lead in which we look for the rhythm of the heart in every 12 lead ECG. So very simple. What do you get in lead 2? Typically the heart activity is also above to below, right to left. Lead 2 also is going from above to below, right to left. You get a positive QRS even in the case of the lead 2 is what you need to remember. Once more tell me, how do you get lead 1? Right arm and left arm, negative right, positive left. How do you get lead 2? Right arm and left leg, negative on the right arm, positive on the left leg. Then the next thing is called lead 3. Now you are all intelligent kids. You know how lead 3 comes? Very simple. Left arm and the left leg are connected. So this is also on the left side, and it is passing from above to below. That is called the lead 3. And there also you find a positive QRS, because even the heart activity is going towards the left side, is what you need to remember. Now comes the summary time. Summarize, doctor, the story once more. Dil laga ke bolo, I will make you the ECG experts. ECG, there is no rocket science about it. There is no rocket science about anything in this world, doctor. You use a simple common sense, clear mind, take out all your fears that there is something very complex about anything. First time when you do the coronary angiogram, while you are making the puncture, it is a big enigma. Later on, first time after you have done it, it is like a routine tooth brushing kind of an activity. Do a puncture, pass a catheter, look into monitor, decide whether stent or no stent, stent or no stent. So, cardiology, neurology, nephrology or anything, doctor, it's a question of knowing clearly what you need to know, knowing logically what is need to be known. Once you know that, you need to practice on about 100 to 200 cases. You are the expert in the world, and that gives you a livelihood. Right, doc? So that's simple. Abhi fatafat bolo. Lead 1, lead 2, lead 3. So what do you connect? You have a right arm, left leg. Now you tell me. Lead 1 means what? Right arm, negative electrode, and left arm, positive electrode. So what is lead 2? Lead 2 is right arm, negative electrode, left leg, positive electrode. What is lead 3? Lead 3 is left arm, negative electrode, and left leg, positive electrode. And how do you get QRS here? Positive. How do you get lead 2 QRS? Here also it is positive. Lead 3 also, how do you expect QRS? It is positive. So what is meant by positive QRS? If you look at the positivity of the R wave, and if there is a S wave, the negativity of the S wave, if you compare the two, overall positivity of the R wave is predominant, then you call it as a positive QRS complex. So suppose if you have a small positive deflection and a significant negative deflection, what do you call this? Negative QRS. If you are having a significant R wave and a small negative S deflection, what do you call it? You call it as a positive QRS. This is what? Negative QRS. This is negative QRS. This is the positive QRS. So now you know lead 1, lead 2, lead 3. Interven's father-in-law is very happy. Oh my God, if my right arm and left arm are connected, I am getting positive deflection. Right arm and left leg are connected, positive deflection. Left arm and left leg are connected, positive deflection. Oh, Missy, I'm having the heart for you, said the interven's father-in-law to the interven's mother-in-law. And he said, see this boy, Dr. Interven, nice guy, finished MBBS. We can give our daughter, let them get married. Story is over, shadi ho gaya, marriage is over. After the marriage, Interven's wife is very intelligent girl. She is MSc, PhD from IIT Mumbai. Right? She said, no, you deceived my father, honey. You just connected 3 leads and said that he has a heart. I know he's a big butcher. He has troubled my mother. So, show me more proof. Show me more proof that he has the heart, so that I will let you to come on my bed. So what did Interven do? Oh my God, this is a new story. New trouble that he has. He need to show much more a significant voltage. What is seen in lead 1 is not enough for this girl. So what did he do? Okay, he went to Volta. What can we do, bro? This girl is really complicated. She is not that simple. She only like the messed up boys. If they are not messed up, at least she will mess up and then reset them. So what to do? Then Volta gave him an idea. Okay. You take the right arm, right? And you take the left leg. Right arm and left leg. You connect both of them, the right arm and the left leg, make them one electrode, let it be minus, and compare it with the left arm. Let this be made plus. So the right arm, left leg are combined, made to become one lead, and then you are trying to connect with the left arm. So this is a stronger voltage. And what is this lead called? There Interven's Interven's father-in-law got more significant positive deflection of QRS. So this is called AVL, augmented lead. AVL. How did you get AVL? Right arm with left leg made one lead, negative lead, and compared with the left arm is what you need to remember. Then, how will be the QRS in AVL? Now you should tell me. AVL, all the charge is going towards the left side. Our body electrical activity axis also is going towards left side. That is the reason QRS will be positive deflection, is what you need to remember. So how will be AVL QRS? It is a positive deflection, positive QRS. Then, how do you get AVR? Now you must tell, you are all intelligent docs, right? So very simple, doctor. Left arm and the left leg, left arm and left leg made to become one electrode, negative. Compared with whom? With the right arm. So this is compared with the right arm. So this becomes the AVR. How is the AVR electrical activity is passing? It is passing from left towards right, from below to above. Whereas our electrical activity is passing from above to down, from the right towards left. So that is the reason. How will you get QRS? You get a negative QRS in AVR. Negative QRS in the AVR. How do you get AVR? Left arm, left leg is made to become one lead, negative lead, and connected with positive lead, right arm. And here the axis is passing towards the right side. So that is the reason in the AVR you get a negative QRS. Negative QRS. 20 ECGs you should check, doctor. You will find how is AVR? How is AVR? QRS will be typically negative. Negative. Then what is left over? Very simple. What is left over? You have right arm and left arm. Make it one lead. Make it one lead, which is a negative lead. And straight you compare it with the left leg. Make the left leg to become a positive lead. Right arm, left arm combined make a one lead, that is negative. And if you compare the two, how is it passing down? It is passing from above to below and towards the left leg. So that is the reason this also leads to positive deflection, and this is called AVF, is what you need to remember. So summarize, doctor. Now you are becoming experts in ECG. You know what is AVL, what is AVR, what is AVF, what to expect the QRs to be in each of them. Shall we summarize? Definitely. So you have AVL, AVR, AVF. Then how do you get AVL? Just close the eyes and remember. Left arm and right arm and left leg combined made a negative electrode compared with left arm. You get AVL. How is QRS? Positive. Once more. How do you get AVR? Very simple. Left arm plus left leg made to become one lead compared with right arm. How do you get QRS? Negative deflection. How do you get AVF? Left arm and right arm are made to become one lead compared with left leg. And how do you get QRS? Positive. But these are all augmented leads. So once more summarize, doctor. Lead 1, how is QRS? Positive. Lead 2, it is positive. Lead 3, QRS positive. AVL, it is positive. AVR, it is negative. AVF, it is positive. This is what you need to ultimately remember. So if some guy comes to you and you want to see how is his axis, do you need to look at his AVL, AVR, AVF, lead 1, lead 2, lead 3? Sabko dekhna hai kya? No, not required. What is, if you consider the electrical axis as a circular, what is that lead which is seedha going from the right side towards left side, doctor? It is the lead 1. Lead 1. So lead 1 represents the equator. And which is that which is straight coming from above to below, where it is negative above and positive below? It is AVF. Okay. Normally, how is the axis passing? axis is passing like this. Normal electrical axis is passing like this. So when the normal electrical axis is passing like this, it is passing towards the positive end of the lead 1. Hence, in the lead 1 you get positive QRS. It is passing towards the positive end of the AVF. That is the reason you get the positive deflection in AVF also. So, दोनों में positive deflection. What is this called? Normal axis. What is meant by left axis? Left axis means this is the left quadrant, this is the right quadrant. So, instead of electrical activity passing like this, it started passing like this. That to become the left axis. So, if it is left axis deviation of the electrical activity, instead of going from Hyderabad to Delhi, it is going from Hyderabad towards Kolkata. So, how do you identify that? If it is a left axis deviation, the axis is traveling towards whom? Positive side of the lead 1. So, in left axis deviation, if you look in the lead 1, you get a positive QRS. And if it is a left axis deviation, which side of the AVF it is passing towards? It is traveling towards the negative side of the AVF. That means it is going away from the positive side of the AVF. So that is the reason AVF get negative deflection. AVF get negative deflection. Lead 1 gets positive deflection. Then you call left axis deviation. Very simple. Then suppose if it is a right axis deviation. If it is a right axis deviation, which side of the lead 1 it is traveling a right axis? It is traveling towards the negative side of the lead 1 and leaving away from the positive side. So that is the reason in the lead 1, if there is a right axis deviation, you get a negative deflection. But if it is a right axis deviation, towards which aspect of the AVF it is passing? It is passing towards the positive side of the AVF. That is the reason you get a positive QRS in AVF and negative QRS in lead 1. So this is the way by which axis deviation, just by looking at two leads, lead 1 and AVF. Agar lead 1 QRS positive, looking above, lead AVF also it is looking above. The boy is looking up, the girl is looking up, both of them are looking towards whom? Arundhati Nakshatra. They are both getting married. Marriage is normal or abnormal? Absolutely. Supposed to be starting normal and later turn abnormal. So, normal axis may typically lead 1 is looking up, lead AVF is also looking up. Suppose if it is a left axis deviation, lead 1 it is looking up, lead AVF it is looking down. They left each other, That is how you can remember left axis deviation. Then, if it is a right axis deviation, lead 1 it is looking down, lead AVF it is looking up. They are right towards each other. That is how you recognize right axis deviation. Simple, right? So let us look at some of the common ECGs, doctor. Yeah, that's good. Oh, wonderful to see 61 online students. Thank you. In spite of a hot cricket match of India against South Africa in the World Cup, still I could make some sense today evening for you guys, because this is a neat PG batting you have to be really good with, right? So doc, let us see. So सब लोगों को समझ में आ गया ना? What is right axis? What is left axis? पूरा स्टोरी दिल में लग गए ना? हाँ, एक बार ECG देखे तो you will not forget. So doc, you should remember that. Now let us look at this ECG. How is the lead one? Lead one is typically positive. Positive. How is the lead AVF? Lead AVF is also positive, looking up. If the boy is looking up, if the girl is looking up, they both are getting married and looking at Arundhati Nakshatra, so it is a normal situation. Now, how is the lead one? Lead one is positive, but lead AVF is negative, looking down. So they left each other. It is going up and this is going down. So it is a left axis deviation is what you need to remember. Then lead 1 is negative. How is the lead 1 here? Negative. How is the lead AVF here? Looking up, positive. Both are right towards each other. AVF is going down, AVF is looking up, lead 1 is looking down. They both are right towards each other. Hence it is an example of right axis deviation is what you need to remember. Now doctor, what are the causes? What are the causes of right axis deviation, left axis deviation is the favorite question of the examiner. So you should remember, any axis deviation typically occur when that particular ventricle is enlarged. Okay, doc. So normally you have left ventricle which is more thicker and right ventricle thinner. So right axis deviation, first reason you should say right ventricular hypertrophy. Left axis deviation, first you should say most common cause left ventricular hypertrophy is what you need to remember. Simple. Next, left posterior fascicular block lead to right axis deviation. This is too much. Sir, what is this? Fascicles. For us to know that there are bundles only, very big deal. On the top of it, you are talking about anterior fascicle, posterior fascicle. What is the story? And why right axis deviation, left posterior fascicular block? Very simple. The left bundle and right bundle. The left bundle in turn is divided into one anterior fascicle which is more towards left and a posterior fascicle which is more towards right. Posterior fascicle is more towards right, anterior fascicle which is more towards left. Suppose if the posterior fascicle is blocked, what will happen, doctor? The anterior fascicle should finish its job of depolarizing the left side of the heart and it need to travel towards the posterior fascicular territory and cause the depolarization. In the process, the entire depolarization is moving towards right. So that is the reason when left posterior fascicular block is there, you get a right axis deviation. Once more, I will summarize for you. The left bundle is divided into one anterior fascicle more towards left side and a posterior fascicle more towards right side. So if there is any block, posterior fascicular block, the anterior fascicle should finish its depolarization on the left side and need to travel towards the right side to supply the area which was earlier supplied by your posterior fascicle. So that is the reason entire electrical activity is deviating towards the right side. That is the reason you get a right axis deviation in left posterior fascicular block. You'll remember it, right? Suppose if there is a left anterior fascicular block, what will happen? Your left posterior should finish the work of depolarizing the right side and it need to go towards the left and supply the area which was earlier supplied by this blocked anterior fascicle. So in the process, entire electrical charge is moving towards the left side. So that is the reason you get a left axis deviation if there is a left anterior fascicular block. Okay? Now you should tell me, what will happen, let us say, if the left bundle itself is blocked? Which type of axis deviation do you expect if the left bundle itself is blocked? I want to see whether you are awake or sleeping. You please punch your answer. Let us say the entire left bundle is blocked. What kind of axis deviation do you expect? Please punch your answers. I want to see. No, show me the board. So, I want to see your answers. Till now you heard no. Left anterior fascicular block lead to right axis deviation, left posterior fascicular block lead to right axis deviation. If the left bundle itself is blocked, which axis deviation do you get? Nivedita proposes right axis, Shivendra, Raghav, Madhushri, Jindabad. Left axis deviation. Why? Once more, think coolly. Think coolly, doctor. If the left bundle is blocked, right? Who has to do the donkey work of all this left bundle's area? Right bundle should finish its job and then it should go and supply all the area which is otherwise supplied by the left bundle. So what is happening? Entire electrical activity is deviating towards left side. So you get a left axis deviation in left bundle branch block, left axis deviation left anterior fascicular block, but right axis deviation the left posterior fascicular block. This is what you need to emphatically remember, doctor. Agreed? Now, in the ASD, is a favorite MCQ in NEET PG exam. There are two types of ASD. Primum, secondum. The original hole is primum. After that, there is another covering that will come which will close the secondum. So, primum defect, secondum defect are the two types. Secondum is the most common type of ASD. So, if there is a secondum ASD, it also will alter the electrical pathway. Okay. So, it alters the electrical pathway such that a secondum defect lead to right axis deviation, primum defect lead to left axis deviation is what you need to remember. Then if you take the normal infants, children, in them when they are born, our right heart is still dominant. So that is the reason you may find a right axis deviation in infants and children, which is often a normal process, is what you need to remember. So these are the causes. What are the causes of the right axis deviation? Right ventricular hypertrophy. मेरे साथ बोलो, left posterior fascicular block. Now you know why. Secondum type of an ASD, infants and children, you have a right axis deviation is what you have to remember. Now for the left axis deviation, what are the causes you will remember? Left ventricular hypertrophy, left anterior fascicular block, primum Asd and left bundle branch block and even inferior wall Mi also, you get a left axis deviation. Simple. Electrical activity because of any condition is directed and pushed towards left side, you get left axis deviation. If it is pushed towards right side, you get the right axis deviation. Simple. That is what you need to basically remember. Okay, doc. Now you tell me, how is the lead 1? Lead 1 is positive, lead AVF is negative, hence this is a, that is looking up, this is looking down. So it is a left axis deviation. Now comes the precordial leads. Okay, doc. Now you know what is meant by axis, what are the causes of axis deviation. You are the Mahagyani in this important topic. So we will take up the precordial leads, Q wave tomorrow, right? So for today, let us quickly take up the quiz, doctor. I hope all of you had the quiz sent to you as a link. So every day we send you the quiz link. Okay, yes. So lot of you, I am very happy. You are all taking the quiz at least after the class, and you are also sharing with lot of your friends. Thank you for that. Please share to as many as friends as possible so that they can also play and they can join our NEET PG 2020 mission. Okay, doc? Good. So today I created 20 questions. Some of them are image based questions. I hope all of you, can you please punch the quiz link? Quiz link. Yes. Very good. So this is the quiz link, doctor. So please populate it. And if you have not yet subscribed to onlinembbs.com, please do subscribe to the onlinembbs.com. You have an extensive video library, right? And all these lectures are being uploaded into it. Even if you have not subscribed, at least log in into it so that I can send you email every day. Okay? And share it to your friends also. So Vinoda proposes central serous retinopathy. Madhu thinks Cravo. Aishwarya Aishu is proposing central serous retinopathy. Absolutely. Answer is actually C, not D. C is the correct answer. Central serous retinopathy, it is called smokestack appearance, is what you should remember. Now what is wrong about this condition? What is this condition first of all? Question number 2. Yeah. Right. Vinoda is right for the earlier question. Yes. Satya is proposing it is not caused by Moraxella. Now Satya should tell what is that condition and what is the organism that leads to it. Yes. Saundarya proposes sty. Okay. That is called collegion or hordeolum. What do you call it as? So Madhu thinks it is A. So it is basically a hordeolum. Hordeolum is an acute painful nodule on the external eyelid. Zeiss gland, abscess of the eyelid, usually Staphylococcus aureus. You need to do warm compresses, and refractory cases you may need to do incision and drainage is what you need to remember. Now, this 51-year-old man presented with an acute onset of binocular diplopia, injected eyes, periauricular swelling that was initially diagnosed as episcleritis but worsened despite of lubrication and topical steroids. Now you should tell me most probable underlying condition leading to this kind of a ocular appearance is an important question. Satya Snigdha is confident about hyperthyroidism. Absolutely, this is an example of Graves' disease is what you should remember. Now you have been shown a fundoscopic picture. What is it very characteristic of? Fundoscopic picture, what is it very characteristic of? So Vinoda proposes syphilis. Upama Singh thinks of, okay. Saundarya says it's a pale disc. Good, at least common sense. Very good. Satya is proposing age-related macular degeneration. So, what is a drusen? Age-related macular degeneration, central serous retinopathy. These are the topics we don't read in MBBS, but they are the favorite topics for the NEET PG examiner. So, please go back to the online mbbs.com video library and do the revision, doctor. Okay. So, from Monday onwards, we will start the new subject, pharmacology. Till on Saturday, we will have a subject test, Sunday grand test and discussion. And this couple of days we will complete ECG and general medicine. Okay. So most of you are saying age-related macular degeneration. So it's a non-exudative macular degeneration with an extensive geographic atrophy. It's called a geographic atrophy in the eye because of the advanced AMD. Now 51-year-old presented with roundedness and redness, swelling localized below the medial canthus. What is the most underlying cause for this? And what is the diagnosis is the important question of the examiner. Yes. Satya Snigdha is proposing question number 5. Obstruction of nasolacrimal duct. So Satya, what is the condition do you think? Aryan is proposing B. Saundarya also says B. Yes. Upama Singh says B. So what is this condition? Chronic dacryocystitis is the condition, doctor. Most common underlying cause for this is obstruction of the nasolacrimal duct. Now a healthy 18-year-old man was in a motor vehicle accident, received a head injury, and there is an intracranial bleeding, fracture of the facial bones, immediate traumatic mydriasis, ptosis in the eye, and you can see a lot of collaterals which are classically seen. So, what is your diagnosis, doctor? Most likely diagnosis for this condition that you are seeing. What is the most likely condition? Yes. Should your answer, doctor? Very good to see 62. Bring more friends of you. 6 to 8 we have a daily session, right? So Saundarya says C. Okay. Very good. Dr. Balakrishna proposes B. Very good. Carotid cavernous fistula is what you need to remember. Now this is a clinical lesion which is being shown in the figure. What is a true statement about it? What is it and what is the true statement about it? Yes. Shoot a loud answer, doctor. So we have a very good group subscription offer on the online mbbs.com going on. You get 4 of your other friends. So we give 5 activations for a throwaway price of 30,000 rupees. All the 5 of you get 1 year access to the entire video library of around 1000 plus lectures, video lectures. So you can mobilize your classmates. You also get online mock tests, discussions, and 250 past full-scale grant tests are there in the online MBBS.com website. Almost 50,000 MCQs, each question discussed, debated, and PowerPoints are available for you to do the review. So you get the access to almost 1,000 plus hours of content. There is nobody else in this world who created that much, right? So you can mobilize 4 of your other classmates, 5 of you together can pull up around 30,000 rupees. So you get 5 activations of the subscriptions that we offer on the online MBBS.com video library, right? So what is this condition, doctor? It's a lipoma. So lipoma is usually lobulated. It is not pre-malignant. It is not always subcutaneous. You can have retroperitoneal lipomas also, is what you need to remember. So you can always connect to our helpline anytime, and you can pool a group of 5 of your friends, and together you can take 5 activations for a small throwaway price of 30,000 bucks. Yes? Yeah. So this 2D echo, you are seeing a valvular condition, right? So now the question is, what is a true statement about this particular condition, this 4-chamber view that you are seeing, doctor? Yeah? One loud answer. Very good. Soundarya proposes left atrioventricular, it is not septum beta, it is mitral valve which is trying to prolapse down. So what is your answer? Very good. Soundarya is going to be our future cardiologist. So what is your answer, doc? It is a mitral valve prolapse. It can predispose to bacterial endocarditis is what you have to remember, right? So Soundarya, you are from which medical college and from which place? Now, secretory otitis media. Give your answer, doctor. So, Soundarya is from Vishakhapatnam, if I remember. Yeah. Question number 9. Shoot your answer, doctor. Very good. Soundarya is from Vijayanagaram Medical College. Excellent, doctor. Excellent. So, secretory otitis media. Shoot your answer. What is a true statement about it? Question number 9. Yes. Dr. Pandey is proposing it is rare before the age of 5 years. Satya proposes frequently runs a fluctuating course. Serous otitis media is what you should, secretory otitis media. Essential hypertension in pregnancy is what? How do you like to comment about essential hypertension in pregnancy? Yes. So, I'm very sure most of you might have made a sign up into the online MBBS.com. I would like to know whether you are receiving everyday emails that we are sending about the new lessons that are getting uploaded, and the quizzes links also they are getting uploaded. Yeah. So question number 10. Shoot your answer, doctor. Very good. So Upama Singh, Balakrishna, everyone says D. But essential hypertension in pregnancy is usually asymptomatic in clinical presentation. Now, bronchial asthma. Madhu is asking, sir, is it A or C? Generally, under 35, any hypertension is secondary, doctor. Generally, that is the rule. Above 60 also it is secondary, because above 60 you have atherosclerosis that lead to renal artery stenosis, and that is the reason you get the secondary renal hypertension. About the bronchial asthma in childhood, what is your answer? Yes. Shoot your answer, doctor. Very good. Aryan Kumar. Question number 11. Good. Satya is proposing clubbing of the fingers is rarely seen. Question number 11. Right. So, for a acute severe attack, you don't use chromoglycate. And it can be seen under the age of 1 year. Quite commonly, bronchiolitis also presents with wheezes, etc. So the first episode of bronchiolitis and the asthma are a close differential diagnosis. Now, an infant develops jaundice 6 hours after the birth. What is the most likely diagnosis? Is my question to all of you. Yes. Most likely diagnosis. Satya is proposing A. So, any jaundice within the first 24 hours is pathological. So, that is the reason hemolytic disease of the newborn is implicated as a cause of jaundice 6 hours after the birth. Hepatomegaly in a newborn, what is accept about it? Yes. So keep punching your answers. Question number 13. Hepatomegaly in the newborn is a feature of all the following except. Yes. Question number 13. Very good. Sridharan, Soundarya, Chandan, Veerappan, you're all differing between B and D. It is the breast milk jaundice is except, but otherwise galactosemia, neonatal hepatitis, hemolytic disease, congestive cardiac failure, anything can present with hepatomegaly is what you should remember. Prolonged treatment with the estrogens. What is the important effect of the prolonged treatment with the estrogens, doctor? Yeah. Shoot your answer. Question number 14. Yes. 14. So, Satya is proposing stratification with cornification of the vaginal epithelium. Absolutely. That is the effect of prolonged treatment of estrogens. Untreated hypothyroidism in infants, what is it associated with? Yes. Question number 15. Untreated hypothyroidism. Yes. Should your answer? Very good. So, a good number of you are saying D. That's right. That's the reason detecting hypothyroidism in a newborn is very important. It is one of the most preventable cause for the mental retardation is what you should remember. Now, in the diabetes mellitus, what is the correct statement of diabetes mellitus in case of in childhood? Question number 16. Yes. So, I advise you all to take the quiz latest by 3 o'clock, 3:30, 4 o'clock. The quiz is being published and you get the link of the quiz. If you are part of our WhatsApp groups, you get that and you can take an opportunity to solve it on an iOS, Android, any phone you can solve it, you get the result and then join the discussion. Yeah. So, question number 16. Lifelong treatment with the insulin will be required. Generally, it is a type 1 type of diabetes. The only proof of a true labor क्या होता है? What is the proof of true labor is my question to all of you. Question number 17. Yes. Soundarya is proposing D. Good. Sridharan is proposing D. Very good. Balakrishna says D. Right. Progressive dilatation of the cervix is the only proof of the true labor is what you need to remember. Very good, very good, very good. Now, a woman who is 16 weeks pregnant presents with symptoms suggestive of UTI. What is correct? A woman who is 16 weeks pregnant has symptoms of UTI. What is correct? Yes. One confident, strong answer, doctor. Somebody is watching cricket. Please tell me what is the score of South Africans. Are they still playing or India started batting? Right. So, question number 18. What is your answer, doctor? Very good. Rupa Tejasvi is proposing B versus C. Okay. So, a midstream urine should be collected and a wide spectrum antibiotic should be prescribed is what you should remember. Right? Very good. So, good. So, anybody following the cricket should tell me what is the ongoing score, right? Now, monitoring of the plasma levels should be carried out routinely for which drug? Plasma levels. Yes. Should you answer, doctor? Satya proposes lithium. Dr. Pandey proposes lithium. Very good. So also Balakrishna and Upama Singh. Very good. To prevent rhesus isoimmunization, anti-RHD gamma globulin, when will you give it? Question number 20. Yes. Should your answer? Very good. 24 for 1. Oh my God. Who is that one who lost? Yes. Question number 20. Very good. Thank you, Sridharan, for the score. Question number 20. It is RHD negative mother without anti-D antibodies with the RHD positive infant. To prevent rhesus immunization, you have to give the immunoglobulin is what you have to remember. There is the next quiz, no? One more quiz. Yeah. So let's look into the day before yesterday's quiz. Yeah. Shoot your answers, doctor, quickly. Another 10 questions we will solve. Yes. The patient with CHF comes with desaturation and basal crackles. HRCT is being shown. Which drug is implicated? Give your confident answer. Also mark the question number. Yes. So it almost became a religion for us every day to play 20-30 question quiz and to have an interaction for about 1.5 hours on some topics, and then going back to the video library on the onlinemmbbs.com and picking up 5-6 topics every day evening and doing the revision. I'm telling you, doctor, without a break, if you are able to do this until January 5th, 2020, you are going to be the sure shot winners of the NEET PG. There is no secret about secret thing about winning NEET PG. NEET PG is all about perseverance, clarity on the concepts, 650 high yield topics, and doing a revision on around 20,000 single shooter and 5,000 lists that you need to master. So once you are into and through them at least one round, you are sure to basically make it happen. So it is classically a case of emidaron is what you need to remember. So I also became addicted to all you guys. So tonight is going to be my birthday, crossing 45 years. Half the first innings of life is over. So my wife gifted this shirt, and I told her the happiest thing I'll be doing is to spend a wonderful time with the next generation of the doctors. Almost 60 of them attending today evening. So every day we should live with that energy, hope, and the dream, doctor. Then only life is worth living. So thank you once more for being the part of our wonderful life and being a encouragement. Even a good teacher required good students like you. And we wish that till January 5th, we will be all together preparing every day and continue this legacy. After you get the rank also, come down, teach, become part of this mission. What you give free will come back to you in 5 times, 10 times, doctor. That's the reason teaching should become your part of your DNA. Very good. So, high risk patients with stable angina, what is the important indication for doing coronary angiography? So, when you are doing a stress test, doctor, a fall in the BP when you are doing the exercise is an indication that you are having coronary insufficiency. So it is not a rise of BP but a fall in BP, which is the important red flag is what you need to remember. If a patient is on warfarin and started on emidaron, this is a very tricky question on the P450 inducers and inhibitors, right? So what do you want to do with the dosage of it is a very important question. Yes. So classical, give a classical answer, doctor. Question number 3. You want to increase or decrease? Is it warfarin or emidaron? Which one do you want to? Is an important question. One loud answer. You need to decrease the warfarin dosage by 25% is what you need to remember. That's good. If a patient has a history of angioedema, he is on ACE inhibitor, what is the drug of choice that you want to give? ACE inhibitors, one of the important adverse effects is the angioedema. So, what is a drug of choice? Question number 4. Very good. Soundarya proposes ARBs, no. Beta blockers. Beta blockers are the drug of choice if the ACE inhibitors, angioedema as a side effect, if it is there. We are not talking about the cough, but the angioedema. Then ARBs are also having a proclivity for causing angioedema in the people who have that proclivity with ACE inhibitors is what you need to remember. The last question for the today's evening. The first choice for the risk stratification. Stable angina patients, if a stable angina patient is there, what is the first choice if you want to stratify the risk? Do you want to do a stress ECG, dipyridinol, adenosine or dopamine with stress echo? So what is your answer? So Madhu and Vinoda. Yeah, Roshan is proposing stress ECG is a preferred rather than the stress echo is what you need to understand. So, thank you all once more for the wonderful evening. Enjoy a nice Indian cricket, India's batting session in the evening. And tomorrow once more we will all meet at 6 o'clock, 6 to 8, take the quiz. Thank you very much.